Dr. Diane Hess joins us now. She is the founder of Gramercy Pediatrics. Dr. Hess, Happy New Year. It's good to see you. Let's talk about what we're seeing in hospitals, pediatric hospitals specifically, that are overwhelmed amid the Omicron surge. What do you say to parents who might be nervous to send their kids into the classroom now?
Well, I would say the number one thing you have to do is vaccinate, because overwhelmingly the number of children who are getting admitted are almost exclusively the non-vaccinated children. And that was left out of that segment, which I was a little bit upset about. The other thing is, if you're pregnant, get your vaccine. Babies who are born to mothers who got their vaccine when they were pregnant are doing much better if they get COVID. They might just be positive or asymptomatic. If you can breastfeed when you had the COVID vaccine, breastfeed your baby, because that will keep them very well protected as well. I have to tell you that in New York City, we're not seeing a huge amount of hospitalizations because we have a very good vaccination rate. It's not the same as the rest of the country. I think still the safest place for kids are to be in school. Parents have to work. They have to scramble for childcare. It's going to go back to where we were. Children are not learning. Children are not thriving. If they're at home, I still think children should be in school. I think this virus is becoming much less virulent and much more contagious. And I think it's inevitable that almost everybody's going to have it. And I think that there's just going to be a cold and that you have to send your kids to school. That's what I think.
So now we're talking about boosters for kids between the ages of 12 and 15. The FDA has approved Pfizer's shot as a booster shot. So I'm thinking about the parents that may be hesitant. There's still an awful lot of children who have not received their first dose. There are some children whose parents agreed to the first and second dose, but the idea of a booster makes them really uncomfortable. And so I ask you this. We have already seen breakthrough infections with adults who get booster shots. Maybe their symptoms are mild or maybe they're asymptomatic, but they're still testing positive. If children are less likely to endure severe symptoms from COVID anyway, would you still recommend a booster shot once it becomes, widely available for 12 to 15-year-olds?
Absolutely, because we see that for Omicron, it's about how recently you were boosted. So, both of my kids had boosters and they were exposed to COVID inadvertently and they didn't get COVID. And I really think it's because, and they went to dinner with people, so their masks were off. And I really think it's because they were boosted. So I think that's really important. I think that the booster, until we have a newer vaccine that might be more effective to prevent these cases, I think the booster is our tool, our armament to keep our kids in school. I think that we cannot go backwards. I think that when you ask any hospitalist, who are the kids who are getting hospitalized? First of all, they're almost overwhelmingly kids with underlying illnesses. That baby was a preemie, okay? Secondly, 2/3 of the kids who are being hospitalized are obese, still left out of the discussion. We need our kids in school. We need them moving. We need them active. We need their minds engaged. We need them to learn how to speak. We need them to learn how to read emotions. I want the kids in school. I'm really questioning whether these masks are even effective. If 1 in 3 people have COVID and 20% in New York City and we're wearing masks, are the masks even effective at this point? Is it just going to blow through and everybody's going to get Omicron?
Yeah, it's a good question, doctor. Although, I wonder if people are wearing masks the way that they should properly, right? There's a lot of people that I see still, I was thinking about this the other day as I was jogging home. I saw a lot of people in the streets of New York City, which I feel like it's probably there's probably others, but it's very rare that you see people wearing masks outside while they're on their way to the supermarket. And less people point fingers about why are you doing that. It's probably because this is a walking city and people are going from the grocery store to, their bodega, and, they have to take it out and put it on and take it off and put it on, and people are just leaving it on and going on to the next place. I understand that, but you do see a lot of people who are wearing them improperly. You see them below their nose. You see people, when they want to talk, I think it's a human nature thing. You don't think people can hear you, so you pull the mask down, you say what you want to say, and then you put the mask back up. I see a lot of that. So it could be the way that people are wearing them.
I want to ask you about a case out of Israel. This is sort of like what we had been warned could possibly happen. Israel reported a case of a woman with both the flu and COVID. I can't remember if they call it fluovid or there was some sort of weird kind of combo name, non-official, not a medical term. But it's not flurona. There you go. Thank you, Sharon. But it's not, so I want you just to talk to people about this, because I heard some conversations online where people thought it was like sort of the evolution of the coronavirus. Can we just talk about what they saw in Israel, what exactly it is, and how we can protect ourselves? Because after all, it is flu season. And you also hear some of the conspiracy theorists say, "Oh, isn't that interesting how the flu just suddenly disappeared?" The flu hasn't disappeared; it's still there.
Well, actually, we've been seeing this all along. It just doesn't get publicized. So you can get many viruses at the same time. And so I've had patients who've tested positive for COVID. I had a baby that tested positive for COVID and RSV, and she actually did quite well. So you can get COVID and flu at the same time. If you are underlyingly ill, have an underlying condition, it could be worse. Listen, it's not optimal. I actually just received a testing kit for my office that tests for flu and coronavirus at the same time. So one swab instead of two. So it's not shocking. I think for non-medical people, it sounds like exciting, but we often test people and they're positive for two viruses at the same time all the time. It's kind of
right.
That's what it is.
Just out of curiosity, and you may not actually even know this, doctor, but we do have various variants floating around. Can you test positive for more than one variant of the coronavirus simultaneously? Do we know if
you
cases
probably
like that have popped up?
But they're not. That's a really good question. I'm pretty sure you can, because it's two different strains, but we don't even have the technology to do that. That's the biggest problem, that they're not releasing the monoclonal antibodies to all the hospitals, whereas the hospitals don't really know if they're having the Delta surge still or the Omicron, because some of the monoclonal antibodies work for one versus the other. And that's been a big problem for hospitalists right now.
Ooh, wait, so hold on then, Dr. Hess. I have a question, because Anne-Marie, like, that opened up sort of a can of worms in my brain. I'm like, okay, if you can potentially be infected with two different strains of coronavirus, isn't the common cold a coronavirus? Correct me if I'm wrong, I'm not a doctor. Isn't the common cold a coronavirus? And if it is, how do we know that the tests that we're getting, like all of us are getting, especially those of us that are coming into work, getting tested regularly, how do we know that the common cold isn't showing up as a positive on our tests?
So it's not the same. So the coronavirus HK, which is Hong Kong, which is the previous one, and there's other strains, they do not test positive. And that was a big question when we first, way back when, 2 years ago, developed the test. It doesn't show up. But I can tell you that my son has had every virus this year except coronavirus, and he actually had he actually tested positive for like the old-fashioned just cold coronavirus at one point. Yeah, it doesn't test positive on SARS. It's not a SARS virus.
Got it. Wow, fascinating.
Yeah. Dr. Diane Hess, pleasure talking to you. Thank you.
Well, yeah, we're all becoming virologists now.
We really are.
At least in our brains.
Okay. All right.
At least, yeah, that's right. Only in our fantasies. Thank you. President Biden is going to be making remarks during a meeting with the White House COVID response team today. He and his advisors will discuss the rapid spread of the Omicron variant. Hopefully we'll hear more about the tests that are going to be distributed. You can stream that right here on CBSN at 2 p.m. Eastern.